Runner's knee causes and treatment. The inside surface of the kneecap can become irritated, runner's knee, if there is too much stress on the knee from overuse and repetitive motion, injury, or misaligned bones. Runners are at high risk for pain under the kneecap due to the constant knee bending involved with the running motion. This is true for any sport that requires constant knee bending: skiing, football, biking, basketball, and so on. Repetitive flexing and straightening the knee may overstretch or tear the tendons, cause the kneecap to unnaturally rub against the knee joint, or irritate the kneecap nerves, all of which result in placing additional stress on the knee and can result in pain under the kneecap. Symptoms include a dull, achy pain behind the kneecap. Pain may worsen with walking or running, especially if on an incline or decline like stairs. Pain may worsen with prolonged sitting. Pain may worsen with bending the knee during a kneel or a squat. Pain may worsen if the knee remains in a bent position for an extended period of time. May feel a grinding or grating sensation upon knee extension. May experience slight swelling, and the knee may lock up or give away. Acute stage symptoms are characterized by swelling, redness, pain, and possibly a local sensation of heat, indicating inflammation. If coolness makes your pain feel better, then the acute stage treatment is recommended. Apply the Sinew Herbal Ice on your knee to reduce redness, swelling, and inflammation while dispersing accumulated blood and fluids to help restore normal circulation to the knee. The first aid treatment is used in place of ice to significantly speed up the healing process. It reduces the swelling and inflammation more effectively than ice, allowing you to more quickly regain range of motion. Ice is not recommended because it does not help repair damaged tissues and keeps everything in the injured area frozen, causing the stagnation of blood and fluids and the contraction of muscles, tendons, and ligaments. In Chinese sports medicine, ice is not used and is considered a culprit in injuries that don't heal well. Massage your knee with acute sinew liniment to relieve pain, reduce swelling and inflammation, break up clotted blood and stagnant fluids, and stimulate circulation of blood and fluids to help cells quickly repair damaged tissues. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Chronic stage symptoms begin once the swelling and inflammation are gone, but you still feel pain, stiffness, weakness, and/or sensitivity in cold and damp weather. If heat makes your pain feel better, then the chronic stage treatment is recommended. Massage your knee with chronic sinew liniment to relieve pain and stiffness, strongly stimulate circulation and blood flow to damaged tissues, and promote the healing of overstretched tendons and ligaments. Apply the sinew injury poultice on your knee to significantly stimulate circulation and blood flow to damaged tissues, relieve residual pain and stiffness, and further promote the healing of overstretched tendons and ligaments. Soak your knee with the Sinew Warming Soak to bring warmth into the knee to drive coldness out of damaged tissues, increase local circulation, ease joint pain, and increase range of motion. The Sinew Warming Soak is particularly useful if your knee is more painful and sensitive to cold, or hurts more in cold weather. The soak can be used by saturating a towel in the liquid and applying it to your knee. The Sinew Sports Massage Oil is recommended for use before and after exercise, sports, and strenuous activity. It warms and stimulates your muscles, increases circulation, and relieves tightness, hence improving your performance and helping to prevent injury. Thank you for watching. For more videos, subscribe to our YouTube channel. To learn more, visit sinewtherapeutics.com.